when we think about colorectal cancer, we've actually talked about early onset disease, and that's usually people who are younger than 50, talking about, people who are at average, typically what we think of 50 and older being diagnosed. But I think as we're starting to hear that, and we're starting to think that, we know that there might be people in their 20s, 30s, 40s, that even in that lifespan left of center, that we know that those challenges are different. Sometimes people are young parents, sometimes they're just starting their own careers, sometimes they're still in school, and so those challenges in terms of what does it mean for treatment, what sort of decisions people are making, that is very different than if you were in your 50s. So for instance, fertility. If you're in your 20s and 30s and you haven't started a family, thinking about fertility preservation, thinking about what kind of options that you have are something that are very different key decision points that you would make, than when you're later in life. If you're really thinking about, sort of the things about like the vitality and where we're moving, someone who's retired doesn't think about the same issues as it relates to things such as keeping a job or really like independently supporting dependents, whether those are children or whether those are people that are actually supporting their parents into older age. So there's very different types of issues, and those are things that we have to consider. I think as the research community also considers this, there's a lot of ongoing discussion whether the disease type for colorectal cancer for young patients and older patients. And so the more that we learn about maybe even what we do and don't know also biologically about the cancer is going to be a huge important part of that. But moreover, I think when we think about those treatment decisions, what do you do with this information and how does that impact you when you're younger? That has stronger implications for you, family, first degree relatives, children, siblings, as well as even how did that impact, the larger family unit, including parents.